The sperm count is the basic investigation we use to analyse the male fertility. It's the first of a number of possible investigations we might like to carry out. It's very easy and requires the man to produce a sample by ejaculating into a pot. We ask you normally to have abstained from ejaculation for 2 to 3 days, and the sample can be produced in a private room here at the Agora clinic, or we can allow you to produce a sample at home as long as you live relatively close to the clinic, because we have to have the sample analysed within the hour. The sample is collected and then passed to our laboratory team, where it's analysed under the microscope to look at the sperm count, the number of sperm we can see in the sample, the motility of the sperm, how well they're moving forwards, as well as the shape of the sperm, because there's a large number of sperm that are formed that are functionless, they're abnormally shaped, but we need a certain minimum number that have a normal shape to be able to fertilise the eggs. So a normal sperm count is measured in the number of million sperm per mil, and it needs to be above 15 million sperm per mil, which is obviously a huge amount. And if we look at the typical ejaculate, men with a healthy sperm count could be producing 100 million sperm, 150 million sperm. But only 32% of the sperm need to be moving in a forward direction. So that's called progressive motility. Often we find samples with much more than that, 40, 50%, but a minimum 32% is what's required to be classified as a normal sample, and we need at least 5% of the sperm to be of normal shape. And so when we see sort of high levels of abnormality, which we see often in samples of men coming to the infertility clinic, that does compromise the chances of successful fertilization of the egg. And we always say that sample is just a snapshot in time. One of the things you'll be encouraged to do after you've done the sperm test is to have a fertility consultation to go through the results, look at your lifestyle, look at your medical history, see if there are any factors that could be relevant. You start to form sperm at puberty, and it's formed over a period of 3 months continuously. So if you make some lifestyle changes, you can often find that sperm quality will improve over the sort of ensuing 3 or 4 months, and when you repeat it, it can potentially become normal.